Claire McCaskill, a senatorette from my home state of Missouri, says, let's try national health care first. Let's just see. Try it. During a stop in Springfield, Missouri Senator Claire McCaskill said that people need to try Obama's national health care plan before they knock it. She says it hasn't been put in place yet. People are pretty sure they don't like it, but once they do, she goes on to say that they'll be reminded why health care was reformed in this country. She says that the ways of dealing with health insurance companies will be gone, and people won't have to worry if their employer is going to drop coverage because it's too expensive, because the government will have it, and if you don't have it, you'll have to buy it, and if you don't buy it, you'll get fined. You should try this. You'll like it. She also says that multimillionaire executives won't be allowed to pull down huge paychecks, and the pre-existing condition clause will be done away with. Really? Multi-millionaire executives won't be allowed to pull down huge paychecks. Really? That's part of Obamacare? I know that that's what Obama wants over, but is that part of Obamacare? Multi-millionaire execs won't be allowed to pull down huge paychecks? As though it's Obama's business, what people earn? But look, no, she's dead serious, Snurtley. She thinks that we can try it, and if we don't like it, we can dump it. She doesn't get it. She really doesn't know. Once it's implemented, that's it. Rolling this thing. But you ever heard of an entitlement that's been rolled back and stopped? You ever heard of an entitlement that's been defunded? Try it. Well, no, it's just like kind of like Pelosi. Look we're going to have to vote for this before we find out what's in it. McCaskill saying you're going to have to try this before you'll really know what it's like. Also from thehill.com, White House has diverted $500 million to the IRS to implement the new health care law. The regime is quietly diverting roughly $500 million to the IRS to help implement the president's health care law. The money is only part of the IRS's total implementation spending, and it's being provided outside the normal appropriations process. Does Obama ever do anything within the normal process? Republican lawmakers have tried to cut off funding to implement the health care law, at least until the Supreme Court's decided whether to strike it down. The regime has plowed ahead despite the legal and political challenges. It has moved aggressively to get important policies in place, and according to a review of budget documents and figures provided by congressional staff, the regime's also burning through implementation funding provided in the health care law. Must be a slow news day at the Politico, because what they've done here is commit a random act of journalism, whether they know it or not. What the Politico's done here, they have found that Obama has quietly diverted, not allocated, not appropriate, diverted, quietly diverted. I mean, taking it from someplace else and redirecting it to. It's $500 million to the IRS to enforce Obamacare. Now, look, I know the answer to this. I just want to ask you, hypothetically here, why in the world does the IRS, why do we have a health care plan that requires the involvement of the IRS? That's the question. That's what everybody needs to be asking themselves. You might think health care is about affordable health care for all Americans and free for many. And never again will you be turned down. And always will you be treated for whatever's wrong with you. It's magic. It's going to happen. Your premiums are going to go. Even with that, why do you need the IRS? What does the IRS do? The IRS collects money. The IRS is there to make sure that we are all complying with tax law and then to find those who aren't and to get it from them. So what does that have to do with health care for all Americans? Why does the IRS have to be involved in implementing a health care bill? Well, you and I know the answer. I'm just You ought to understand here, folks, there are gazillions of new listeners here each and every day. Many out of curiosity. So Obama has diverted $500 million to the IRS to enforce health care. What is the IRS going to go to doctors' offices and make sure that they treat you when you walk in? Is the IRS going to make sure that if you have a pre-existing condition that your insurance company or your insurance period covers you? What is the IRS involved here for? And the Politico says that Obama did this outside the normal appropriations process. So as the Hill notes here, this $500 million to the IRS is just part of the money the White House is shoveling out the door. The article notes that Obama's burning through implementation funding provided in the health care law. Obama also gave the Department of Health and Human Services a $1 billion implementation fund to use as it sees fit. That's a slush fund. Polite term for giving as much money to his friends as possible before the elections. This is outrageous. They found it. Now, they think it's a good thing, though. While they've done a random act of journalism, the people at the Hill.com, this is a wonderful thing. The IRS, they're out there to ensure that there's uniformity. The IRS is out there to ensure that there's fairness. The IRS is there to ensure that people comply. Right, because we live in the United States where everything happens as a result of being forced by the government to do it. That's why you have the IRS. You have the IRS because we are being forced to do something. And if we don't do it, they are the mechanism whereby we will be found and dealt with. In this case, fines will be levied. It'll be part of your tax return. If you don't get health insurance, they're going to find you, and you will be audited or you will be found out, and you will pay your fine. That's why the IRS is involved. In health care legislation, what do you think health care is for? It's when you have a catastrophic illness, you want to get treated, when you need surgery. What's the IRS got to do with this? In the normal ebb and flow of the whole concept of being healthy or being sick, what does the IRS have to do with this? It's very simple. The Hill notes in passing how these money transfers, the $500 million to the IRS, allows the IRS to make the health care law a smaller part of its public budget figures. In other words, the IRS is using the shell game to lie about the true costs of enforcing Obamacare. If they're given $500 million, then they can report that enforcing it's cost much less. But still, the question, why in the world is the IRS there to enforce a health care bill? I thought this is all being done with love and compassion, caring for people, making sure if they got sick, they got well, making sure that they had insurance, all wonderful things, all really great things. Getting us even with all the great nations of the world like Cuba who have great health care, whereas we don't. My point is that when you have a massive piece of legislation like this that requires an agency like the IRS to deal with enforcement, you better have a lot of red flags go up. Because the key word is enforcement, making sure that we comply. That means the regime they're charging ahead with the fact that they are going to be able to require us to buy health insurance. They are not waiting for the court decision. They're not waiting for the Supreme Court to rule on this. They are assuming or guarding against, either way, what happens by implementing this, making it tougher to get rid of it once it's implemented. But it all revolves around being forced to buy health insurance or pay a fine.